Hi, my name is Deepak Gadgi. I had a problem with migraine initially, which was lasting for more than 4 to 5 years, and I went to a lot of allopathic doctors, physicians. I met them, and I used to get medicine for immediate cure for a certain period of time, but it used to reoccur every month. One time I even did my endoscopy. After 4 months of medication, 2 months of medication, I again saw the reoccurrence happening again after 4 months. Then I thought this is not the solution for me, and there should be some other medicine, alternative medicine, where I need to get this cured. So accidentally, just by intuition, I went to Dr. Sunil Mehra's clinic, which was very close to my house.
Why you are saying it is migraine,
Yeah.
and why endoscopy was done? Because migraine we say
we
it's a
thought
headache.
we thought it was acidity, and we went to the doctor for gastroenterologist.
Okay.
So they said if it's acidity, then we'll do an endoscopy necessary. So we did the endoscopy, we took the alternative medicine, we took a lot of migraine medicine for migraine, and nothing happened for
So
me.
why? Who diagnosed it as migraine?
Uh, Dr. Sunil Mehra diagnosed it as migraine, not as acidity.
Okay.
So rest all of them, even I thought personally it is acidity. But actually it was migraine, not the acidity problem. Even I went and tested my eyes, saying that it could be due to some problem with the eyes. It was not because of the eyes also.
Were you getting some headaches that time?
Yes.
Okay, fine.
The headache used to last for 6 to 7 hours. It was very severe. Severe in the sense I couldn't concentrate. I used to feel very irritated to talk to people. I couldn't do anything. So it was getting very weird for me. So I wanted to get a permanent cure for me in the long run, because I had suffered a lot. So by intuition I went and met Dr. Sunil Mehra. The first meeting which we had, so Dr. Mehra explained me the process of the treatment, and he took me into confidence whether he can start the procedure. I agreed to it because I felt it is very different way where the other doctors had given me the feedback or done an initial diagnosis or even talked about the process. So nobody talked about the process, how they're going to treat you and see the problem at a different angle. And also we also discussed a timeline how this uh, will get cured. So we didn't expect any uh, unexpected timeline. We had a very uh, reasonable timeline of 4 to 6 months, which I've seen has been worked out very positively. So then we started in the course of the treatment, we started the process of diagnosis and the medication we started. So I just followed the instruction of Dr. Mehra. I just religiously followed what he said. I didn't deviate from anything. So even when something happened, I used to come and tell him in my next weekly meeting or a fortnightly meeting. So I got the diagnosis done and his feedback. So I carried the feedback and I stick to the plan which he had given me. So every day I used to write my diet plan, which is very important, and also I used to take my medicines which he gave me at a regular intervals. So no day I forgot to take a medicine. So the other thing which I've seen from this treatment is I used to have fever or get cold and cough during the seasonal changes, weather changes. What I've observed is during the course of the medication, this has not happened, though there have been a couple of seasonal changes which has happened during this tenure, which I personally feel this is one is good for the because of the analysis and the medicine which Dr. Mehra has given me. Uh, Even if since the migraine was so severe, it's not that it didn't reoccur. It occurred a couple of times, but that's it. It is not that I used to get every month or I used to get twice a month. So that occurrence has shifted from a month to maybe a 2.5 month or once in a 2 month, which normally I think it will go off in a few couple of months as a permanent cure. The the fortnightly feedback or a weekly feedback is very important for me, because then I could see my mistakes, where I'm doing my mistakes, where is this eating habit or is a medical medicine which I am forgetting to take. Then the emergency pill which Dr. Mehra gave me to take whenever there's a migraine, I never felt that the need to take it at a regular interval. So because the reoccurrence happened only once in 2 months, I had to take this on a SOS basis just once in my whole treatment period. We are talking about now 3.5 months. So which is a,
What do you feel the overall percentage of recovery?
if I look at the overall percentage where it used to occur once in a month, so now it has gone from once in a month to in the 3.5 months it's just occurred once. So you have
Okay.
to rate that it is around 70% recovery.
Can you comment on the treatment method, or on the doctor, or on homeopathy, whatever you feel?
See, the doctor's approach is very good, and he tells you openly what is his approach. So you have to, as a patient, if you want to have a permanent cure, if you want to get cured for your illness, you have to just religiously follow the doctor. You have to believe in the doctor and go with what the doctor says. There's another good thing which you also come to, once you come to the clinic, you'll also get to read a lot of feedback from the earlier patients. There are certain things which are important, which are already written and as posters have been placed in the clinic. You can go through it, the diet charts and rest of the things. So that will also help you in getting tuning and aligning with the doctor's diagnosis and the process of
Can you
your
please
treatment.
tell us what specific thing that you have learned during this treatment?
I strictly followed what the doctor said. I didn't do anything which I used to have a lot of junk food, which I stopped having all these junk food. And then because I personally wanted to get cured. The other thing is I just followed took all the medicines and I followed the routine of what Dr. Mehra advised me. And I wanted to stay healthy and stay fit. So I just followed whatever Dr. Mehra gave me a feedback.
Anything specific you want to say or suggest us?
See, as far as the medicine is concerned, homeopathy medicine, I never took homeopathy medicine in my lifetime. So this is the first time, and I have seen the benefits in the 3.5 months. So I believe this has worked for me, and it can work for anyone else for any kind of an ailment which they follow your process and diagnosis. As a feedback, I don't have anything specific to tell to the doctor at this point in time. I think they are doing a wonderful job, and hopefully they will continue to do the same.
Thank you.
Welcome.